Malcontent News is a team of journalists, activists, and researchers with three key missions. A commitment to show an unfiltered view of the before, during, and after of key events, live, as it happens. To defend the First Amendment using our rights of a free press. And to amplify the voices of underrepresented individuals including Black, Indigenous, persons of color, and the LGBTQIA+ community. Our team is committed to seeking equality for all and holding those in power accountable. The easiest way to support Malcontent News is to bookmark our website at malcontentnews.com, like and follow us on Facebook, subscribe to us on YouTube, and follow us on Twitter, TikTok, Twitch, Instagram, and in the Google News app. To provide financial support, you can become a patron, make a one-time donation through Venmo, or link your Twitch account to your Amazon Prime account and use your free subscription to subscribe to Malcontent News. Thank you for supporting independent journalism and for being a malcontent.
Good evening, malcontents. My name is David. I am the malcontent. Today is Thursday, January 6, 2022. Happy Insurrection Day, he says sarcastically. I want to say hello to everybody who is out there on TikTok and also on our other channels. I almost said TikTok again. Twitter, Twitch, they're all T. Y'all need to come up with better names. They're all T. Twitter, Twitch, YouTube, and Facebook. First thing I want to say is, if you're on those other channels, not TikTok, spam those hearts, go ahead and blow it up. Let our mods and admins know that you really appreciate the hard work that they are doing for you. Mods over at TikTok are probably going to be working overtime tonight because I know a lot of people have been waiting, asking, when are you doing a live? When are you doing a live? And there's been a shit ton, I know, not a very professional term, there's been a shit ton of news, particularly in Washington State and on the COVID front, and we've got all of it. And there's not a lot of good news. There's just not a lot of good news. Hello, Mandy. Hello, Rashi, Shelly, Dora, Jen, Catherine, Courtney. Oh my God, Courtney, I miss all of you. I hate COVID. I hate it with the fury of 1,000 suns. All right, with that, we've got a lot to cover. I didn't pull the studio door closed. I need to pull the studio door closed, and we're going to roll. So I'm coming back. Oh, here. Everyone on the other channels, you can enjoy this. I know lots of you would like the technical difficulties roll that we have there. All right, let me go ahead. We got a lot of slides. We're going to go ahead and start up the slides. Or not. Oh, good. I was going to say, or not. We had this problem 2 shows in. I want to start with a quote about fear, because we're going to talk about some scary topics tonight. And I really don't have a lot of good news to present at a national level, at a Washington State level, at a King County level. And the quote I want to start with tonight is, nothing in life, I don't know why we had that glitch for a second. Nothing in life is to be feared. It is only to be understood. Now, Marie Curie said that, and I picked her quote because, as if you're not familiar with Marie Curie, she played around with lots of radioactive substances and figured out radioactivity. And she definitely lived by this credo of nothing in life is to be feared. And working with all the radioactive isotopes that she worked with killed her, ultimately. Because she wanted to understand it. And I think this is a good quote. And the reason I say that is there are certain people in certain communities that go, I'm not afraid of anything. They do a lot of projection. They're actually very afraid. They're just projecting it out. But that's a conversation for a psychologist in a different time. It's okay to understand something, but you need to respect dangerous things. And COVID is a dangerous thing. And that is why I'm starting with that Marie Curie quote about nothing in life is to be feared. And that is very true. There's only to be understood. But you need to respect dangerous things. We may want to understand a snake. That doesn't mean we're going to go ahead and spend the night in a room full of cobras, as an example. All right, real quick. Omicron's a variant of concern per World Health Organization. If you've missed that part, sorry for you. Ton of mutations. There's slides. If you want to see the slides, I see a ton of people have come in on here. If you want to see the slides, you can go to malcontentnews.tv. That's the fastest way to get there. That's on Twitch. You don't need the app. You just go in a browser and you don't need an account. You will get a thing going, are you 18? You just say, yeah, I'm 18, and you can go there. You get to see the slides. There's some people, apparently what I'm hearing is they watch on both because they want to interact with like the streaming chat on TikTok, and then they watch us on malcontentnews.tv. We're also on Facebook. We're also on YouTube. It's just, that's the quickest way to get to us is through that URL. All right, 3 key questions that we've been trying to answer. Is Omicron more transmissible than Delta? That gets a yes with an asterisk. You're not seeing the slides, but explaining it. Why the asterisk? Because we do not have a peer-reviewed study that has come out and said, well, yes, by golly, it is. And by the time we get that study, this is going to be over anyway. So we don't like using non-peer-reviewed content, but we have to with Omicron because it's moving so fast. Is it more transmissible? Yes. Is Omicron more vaccine resistant? We've moved that one to yes with an asterisk for the same reason. Tons of studies that support that statement. Nothing that is peer reviewed yet. The other thing is, remember, when we say it's more vaccine resistant, there is also a ton of studies that indicate that if you get a booster, very, very effective. Is Omicron more severe than Delta? And the answer to that one is unlikely. And we don't put an asterisk next to that because we're not making a statement of yes or no. So there is no. But we think it's unlikely. Is Omicron, but the key there, is it more severe than Delta? Not is it more severe than a cold. Remember, Delta was the monster big variant that we had go around the planet. So that's what we're comparing it to. So it's likely. I want to talk about South Africa a little bit because this is going to frame the conversation where some things that are like, it's not very good news. I did a TikTok on this. The rest of the channels, if you didn't see it, then this is good. You get to see the slides. If you saw the TikTok, you saw the slides. TikTok's up today. So don't leave now. You can leave afterwards if you want to go see it. We're looking at the new case rates that's going on. And before Omicron arrived in South Africa, they were logging literally just a few hundred COVID cases a day in a country of 60 million people. 59.7 if you want to get pedantic, have ADHD. So that's not a lot, right? I mean, that's just, you're living life, right? It's not even endemic at that point. And then we had this huge peak, right? It surged up right around the middle of December. And then it started to go down. And if you kind of notice, nobody talks about South Africa anymore. And there's kind of like this, I think a lot of people have this impression it's a U. It just went up, it went down, and it's done. That's not what's happened. What's happened is that starting around Christmas time, it's dropped, but now it's plateaued out. And they're logging about 8,500 cases a day. And they've been doing this now for about 10 days, 8,300 to 8,700. Again, if you want to get pedantic on my ass, you can. It's plateaued out at a very high rate. Now, there's another thing that happened. On December 23rd, South Africa announced that they were only going to test people who were symptomatic or at a verified close contact. That's it. Very similar to what some states are doing here in the United States. So they've reduced the number of tests that they're doing by about 30 to 40%. We know that because we could look at the tests they were doing before they made the change and the number of tests they're doing after they made the change. And we can ignore the Christmas week. because obviously tests are going to go down during that week. But now we have almost a week of data after New Year's. We're almost there. And we can do that comparo. We're like, okay, it's 30 to 40% lower. And if we factored in, right, if we go, let's play math and add it in, it brings us up to maybe about 10,500 cases. The other thing is they're at over 20% positivity still. So they're still significantly under testing. So Omicron's not over. It did not go up and go down. There's this long sustained tail that is going on. So what's happening there? What's happening is it's spreading out, which is something we said it was going to happen. This was centralized in Gauteng. And the concern that we had is when they had their summer break, Christmas and New Year's, because it's summer there. Like, why is he saying summer? It's summer there. Our concern was this would spread out, right? People leave the cities, they're going to go see their family, or families are going to come see their, or going to go to Johannesburg or Pretoria into Gauteng province to see family, and they're going to bring it back. And that's exactly what's happening. There are some provinces in South Africa that are having record number of cases right now. So that's what's going on. But it's not as bad as I thought it was going to be, and I have that accountability on that TikTok. Next thing I want to talk about is recovery rate, because this is where we're moving to, it's likely not as severe. This was actually one of the things to drive us to go, you know, it's probably likely that it's not as severe as Delta. The recovery rate bottomed out close to 90%. Now, that didn't get as bad when Delta was going through. When Delta was going through, it got close to 85%. That's a big difference. And so what's happened is it bottomed out about 90.5%. It's now plateauing out at about 93%. Now, that does not mean that 7% of people who get COVID are going yeet and getting unalived. People on the other channels, I can't say certain words on TikTok because it's Orwellian. I love and hate this platform all at the same time. And I really hate the Orwellian speak that you have to do on TikTok. Anyway, that's why I say yeet, unalive, and that's why you hear a lot of creators use those words. They don't like the D word. Can't say the D word. And I don't mean dinner. That doesn't mean there's a bunch of yeets, because you still have a bunch of people who are in the hospital, so we don't know if they're going to get better yet. So that's why you have 93%. The other thing is it'll never get to 100% because not everybody gets better. Before Omicron, it was around 97%, 96.8%. It dropped down almost to 90. It's starting to come back up. That's good news, because that is a sign that it is not as aggressive as Delta. It's not as virulent as Delta. Try not to use the M word. Another thing really people aren't talking about in South Africa is the mortality rate. Can't say the D word. Mortalities are up to 78 per day, 7-day moving average. If you are on the other channels, you can see the charts. And when you look at that chart, what you can see is the line's just going up, it's like this, but it's still going up, because things are running its course. Because what South Africa is telling the world is, if you're unvaccinated and you end up in the hospital, the disease progression mirrors other variants. So your odds of getting better are no different than other variants. So one of the things that's lost, the nuance that's lost in this, is this message of mild. I hate this word now. I hate it. If you are vaccinated with a booster, accurate statement. If you are unvaxxed, you're one dose J. I learned this today. 16.2 million people in the United States have J&J. That includes me. Only 3 million have gotten boosters. I don't know who you 13.2 million people are. You desperately need to get a booster. One dose J&J is not going to cut it. And there's a ton of data in South Africa. To quote J&J, it'll keep you from the D word. That is almost word for word from J&J. That's where they set the bar. Well, it'll keep you from a dirt nap. There, I can put it that way. So here's something you probably don't know. What's happening in hospitalizations? South Africa set a record today for the Omicron wave. For the most people hospitalized. 9,603 are hospitalized. Numbers are going up. Cases are going down, but we're only testing people who are symptomatic or had a close contact. Mortality is going up, but hospitalizations are still going up. It's back to this narrative. It's not mild. We know that 85% are unvaccinated in the hospitals, and the last time we saw data from South Africa, 87% of the people in the ICU were unvaccinated. Those numbers are also probably getting a little worse because Gauteng is kind of unique. Like, I know there's so many comments that are going right now on both screens. It's really hard for me to follow right now. There's this stat, 26% are vaccinated against this in South Africa. That is a true statement. But in Gauteng province of 15.7 million people, it's 44%. 66% of people over 50 are fully vaccinated. These numbers mirror the southeastern United States. They mirror eastern Washington, not Spokane, but a number of eastern Washington counties. It actually, for Gauteng, they're pretty highly vaccinated, again, when we compare to the southeastern United States or certain parts of the Midwest or flyover states. I don't like the term flyover states, and I mean no disrespect saying, and I know so, you're just a liberal elitist on the coast, you said flyover state. I used to live in a flyover state. Surprise. Numbers are going up. People aren't talking about this. I'm going to get to why this is important. Why are we talking about South Africa? There's a slide here. It's really complicated. People on the screen can see it. You all can't see it on TikTok. I'm going to be real quick about this slide. We built a really simple model to try to figure out how many cases are ending up in the hospital in South Africa. If you have X number of cases, how many, why, what is why number of hospitalizations. It's a really simple model. We are not epidemiologists. We talk to epidemiologists. And our model's working pretty good. That's what's on the screen. We've had to tweak it a little bit. And what we're seeing is coming into this first week of data where they cut back on the testing, we're seeing the percentage of people hospitalized are going up. That's not surprising to us. So we have a forecast, but admittedly, this is close to throwing a dart, that for this week coming up, we think somewhere between 8 to 12% will end up hospitalized. 2 weeks ago, we predicted between 6.5 and 10%. We're at 6.4. They're still adding up hospital data. We're going to hit the 6.5. I think we need like 50 more out of over 9,000 cases already logged. I think we need like 50 more cases. We're at like 60.44. We're already at target for the week after. We had a range of 6.5 to 9%, and we're already at 6.8%. That's why I'm saying, seeing this curve go up. And so we think we're going to be at 8 to 10% the week coming up. The point of all of this is there's not a ton of good news here for the United States, because South Africa's been lost in the translation. We've cut them out of the narrative for some reason. And what we're missing here about South Africa is it wasn't a U, an upside down U. The cases have not crashed. They're leveling out. People are not in hospital for 1 or 2 days. They have a record number of hospitalizations specific to the Omicron wave, not total. Their total record is in the 14,000s for COVID patients. They're at 9,600. So they're well below their previous all-time record. So you've got that situation that's going on there. The next thing here that's right is the sustained level of long-term hospitalizations. U.S. hospitals can't absorb this. We cannot absorb this. And then the other thing is that the cases are trailing, right? The other thing I think that's going on there is that Omicron is still very transmissible. We know this, and it's spreading. But people's behaviors have changed. Only the most ardent of ardent down the Q rabbit hole are not even at an unconscious level going to change their behaviors. And even if they don't, people around them may change their behaviors, which helps slow the spread down. And so that's part of what I think we're seeing this long tail. And I think we're going to see this long tail here. There's no reason not to believe we're not going to see this long tail, because we are older and we are much more unhealthy than the South African population. The only thing that we have in parallel is the number of people who are kind of down the rabbit hole on New World Order, yada, yada, yada. Today, I'm not even going to try to say his name. You can't see the slide. World Health Organization. While Omicron does appear to be less severe compared to Delta, especially in those vaccinated, it does not mean it should be categorized as mild. Just like previous variants, Omicron has hospitalized people and it is yeeting people. In fact, the tsunami of cases is so huge and quick that it is overwhelming health systems around the world. That's what the World Health Organization had to say about this narrative of mild. And they're asking people, fellow journalists, to stop using the word mild because it's not the right word, because people are losing the nuance of mild if you're vaccinated. Let's talk about the national situation. United States, about 62% are vaccinated. There were 763,878 lab-confirmed COVID tests today. 24.8% of tests are coming back positive. I don't think the United States has ever been that high. Daily new hospital admissions, not the number of people in hospital, the people that are coming in the hospital every day, are now at the same level as November 23rd, 2020, which is when the start of the worst wave that went through the United States from a hospitalization standpoint went through. 126,166 Americans are hospitalized. The all-time record is about 138,000. We're going to break that by Saturday. We will set a new record on Saturday for all-time hospitalizations. A majority are because, not with. I'm going to say that again. A majority of those hospitalized are because, not with. 21,707 in the ICU. Not really familiar with colds putting people in the ICU. Certainly not 21,707 people. Have we gotten that frail, America? Did I miss a memo? New York, Rhode Island, New Jersey, Washington, D.C., Florida, in that order. Highest new case rates. Way to go, Florida. Bravo. Bravo. This is for you. The reason I just on Florida is because they're cooking the books every possible way they can, and they're still in the top 5. For hospitalizations, it's Washington, D.C., Delaware, New Jersey, Ohio, New York, and Maryland. Now, another thing that I found interesting, there's a lot of talk about cases of decoupled from hospitalizations. Go look at the line for Washington, D.C. in particular, but a couple of other states. Washington, D.C., they're not decoupled. They're going up like this, side by side. It's weird because most states they are, but there's a couple of states that aren't. National situation continuing. 3 airlines now have announced they've had to cut back on flights because so many people are sick. Guess who's number 1 on the had to cut back flight lists? You remember the Southwest Airlines CEO who was up there going, hey, masks is the safest place. We don't need masks. It don't feel so good, but masks, we don't need masks on the place. Yeah, and you know how like they have their airline pilots who are like, we're not getting vaxxed, buddy. They walked all, yeah, guess what? They're the airline with the most cuts. They've cut 19% of their routes because so many people are sick with Omicron. JetBlue, 18%. Alaska Airlines, local peeps, West Coast peeps, they announced today they've had to cut 10% of their flights. United, Delta, American, they're still doing spot cuts. They haven't done cuts across the board like this. I want to talk about a couple of headlines that are going around to clarify some things. Flu-rona! Flu-rona falls into the media category of if it scares, it gets shared. It's just a made-up word. There is no new virus. I've heard people go, there's a new virus, flu-rona. It's not a new virus. SARS-CoV-2 and influenza have co-infected, and it's been documented co-infections since March of 2020 in the United States. There's nothing here. This is clickbait. Flu-rona is clickbait. The end. The next thing is, I want to be really clear. In theory, I'm not saying there's somebody out there, boy, this could be the most unluckiest mother on the planet. You could, in theory, have Delta, Omicron, influenza, and RSV cooking in you all at the same time. I don't want to ever have that experience. I would imagine it would be like being attacked by rabid weasels, but on the inside. So, flu-rona, No. The IHU variant. Scary. Lots of scary headlines. IHU. It's the IHU variant. Come to get you. It's only in France. It's from France. IHU is the name the researchers gave it. It's not a WHO designation. I have people, oh, who's named it? No. That's the name the researchers gave it because that's where it was discovered, at a hospital or research institute that's IHU. The WHO has not declared it a variant of interest or variant of concern. They're like, as a matter of fact, the WHO today was like, whatevers. We're not too worried about this. And clearly, because this arrived at the same time as Omicron, it's not out competing Omicron, and it's not out competing Delta. And this is going to go the way of Mu and Gamma and Kappa. What could be interesting is, does this mutate into something else down the road? And of course, the issue of mutations is a bigger issue. But IHU, that's nothing to be worried about. I hate, I've heard like people called I hate you, the I hate you variant, which I love. Monoclonal antibodies. I'm going to go over this slide real quick. There's only Sotrovimab and Evishield. Those are the only two. That's it. Evishield is not a therapeutic for post-infection. Evishield is meant to provide essentially protection for people who cannot get immunized. Not because God said they couldn't get immunized, but because they legitimately cannot get immunized. Because they have a real legitimate immunocompromised disease that they can't get immunizations. That's what Evishield is for. It's also for people who are like organ transplant, they're on big time immunosuppressants, organ transplants, stuff like that. Sotrovimab is the other one. Those are the only two that work. The rest of them don't work. So we have 4 weapons against Omicron coming into January in the United States. We have Sotrovimab. There's the 55,000-ish doses that were doled out in December. Most states have already burned through that. Florida and Texas gave it out like candy. They burnt, seriously, they just went through it like that. And then they were like, what? We want more. Can we have more? And they were like, no, you were given a federal allocation like every other state. We told you that when you got it. 265,000 doses for the entire country. Next thing, Evishield. 65,000 doses? Maybe. In January, that was the number we could find for January. Maybe 65,000 doses. Paxlovid, 300,000 doses for the entire country for the month of January. Molnupiravir, millions of doses. We don't have a number. All we're hearing is millions of doses available. Most healthcare professionals aren't very bullish on Molnupiravir because it's only about 30% effective. And what I've heard from healthcare professionals is, if my choice is Molnupiravir or nothing, then I'm probably going to give you Molnupiravir, if those are my choices. And I may even think about it before I give it to you, just kind of like, how sick do I think you might get? The other thing with both Molnupiravir and Paxlovid, there are a ton of contraindicated medications for both of those. So there are medications that if you're currently taking, I don't want to get this wrong, so I'm not going to say which one to which, but statins, blood pressure medicine, antidepressants, if you have liver disease, you have kidney disease. This isn't for both Paxlovid and Molnupiravir both. These are combining the two together. If you have those, you can't take these drugs. And if you think about how many depressed people, people with high blood pressure, and people with cholesterol problems are in the United States, that eliminates a lot of people that could take those therapeutics. If you're watching me right now and it's like, oh, it's okay, I'll just go get my monoclonal antibodies and it'll take care of this little guy, punt him to the moon. Yeah, you're betting on the wrong horse. That ain't happening. All right, let's talk about Washington State, peeps. Actually, before we talk about Washington State, let's do a little pause for the cause. Go ahead and spam those hearts, blow up those hearts on Facebook, YouTube. If you're watching us on Twitch, you can go ahead and use our remotes, or you can just go ahead and use anything that you want on there. Twitter, sorry, you can't do anything over there. Let our mods and admins know that you appreciate the hard work that they are doing. Over on TikTok, I don't know, you gift me or something like that. They crazy diamond stuff they got, give me sunglasses or whatever. All right, with that said, Washington State. We are closer to a crisis situation than we have ever been. That is Dr. John Lynch of Evergreen Health at the Washington State Hospital Association media briefing that was this morning. This was a pretty chilling statement to me, and I want to explain why. When we had the Delta surge here in Washington State, and we were taking in at that time we were taking in a fair number of patients from Idaho and Oregon, because Idaho was just on fire with COVID. And there was a lot coming into to the point that I was a little surprised that people in Eastern Washington, when things started to get really bad with hospitals out there, same thing with people coming up from Oregon, people Tri-Cities and Yakima, were starting to get very, very frustrated with people from Idaho coming over and people from Oregon coming over because their hospitals were completely on fire. We were really close to crisis standards of care. There were hospitals in Yakima and there were hospitals in Spokane that were openly talking about. There was one hospital in Yakima that was like, we've asked. So to hear the Washington State Hospital Association today say we're even closer is really alarming. And it's alarming even as somebody that predicted on December 26th that we would be where we are. I really wanted to be wrong. It's going to get bad. It's going to get bad. So we'll just keep diving into this. I really wanted to be wrong. What's their situation in Washington? Approximately 71% 5 and older are fully vaccinated. Way to go, Washington. It's not as good as you think. 2 million have received boosters. It's 1.98. 2 million. We have 506 staffed acute care beds left for the entire state of Washington as of tonight. There's 127 staffed ICU beds for the entire state of Washington tonight. Case rate statewide, 579.1 per 100,000 residents, 7-day moving average. It is going up. State can't report positivity data until 2/28/22 at the earliest. I don't think they're going to be able to do that because there's so much data coming in. Omicron is 86 to 90% of new cases. The rest is mostly Delta. It's interesting. When I look at the UW virology report, there's a little sliver that's almost 2% now, which is others. Not variants of concerns, but others. So it's a little interesting. I would love to know what that 2% is, because it's enough to kind of show up in the graph now. Test positivity through UW virology lab yesterday, 31.3%. That's statewide. 95% of what they test comes from Washington. So there's going to be a little bit there that's potentially from Oregon, maybe Idaho that's in there. They do regularly test some small number of tests that come in through Oregon. 31.3%. I don't think our state's ever been this high, and we're nowhere near the peak. COVID hospitalizations, we're up to 1,348 hospitalized. If you're not on malcontentnews.tv, if you're not on Facebook, you're not on YouTube, you don't get to see all the charts and graphs. There's the 7-day moving average line is just this linear line, just going straight up. Not straight up, but it's just this perfect linear line. The daily line is curving up even faster. It's not linear. It is curving this way. And I have more data to show you on how serious the situation is in Washington State. Hospital, I know, like I do the updates, right? Your 8 slides, we didn't do that tonight because we're going to do a live instead, but I'm going to go ahead and do the rundowns. If you're on malcontentnews.tv, I don't mean to chase people off of TikTok. I'm not trying to. It's just, if you want to see the slides, you can go there to see the slides. East Hospital region, when we look at your hospital utilization, you're stressed. We would define this as stressed. People on TikTok can't see the slides. Acute care, 92.5% of the beds are in use. Over 10% of those patients have COVID. ICU, 93% of beds are in use. 21% have COVID. That's a really stressed hospital. And that's 9 counties in Eastern Washington. So if you're like, well, where is that? Northeast Washington, Metro Spokane area, and the Palouse. And if you don't know where that is, don't worry about it. The North Hospital region, that's the islands, the island counties, and the Canada border. So that's Skagit and Whatcom. Whatcom. 86.5% acute care in use. 11.5% have COVID. 67.6% ICU in use. 31% have COVID. Now, here's something that's interesting in those numbers. Over 85% for acute care, you're stressed. So for acute care, they're stressed. ICU, if you're between 60 and 80%, that's where you want to be. But you don't want to be over 30% COVID. That's very, very stressed. Because the thing is, COVID patients in the ICU take up a lot of resources and people. So even though they have only a few COVID patients, the fact that a third of them are in the ICU stresses that region out. North Central, this is the one I always have a hard time, like, what do I call North Central? North Central, that is the east slope of the Cascades, the Lake Chelan region, and the Dry Lakes region. By the way, Dry Lakes, one of my most favorite places on the planet. It is gorgeous there. You're at 82% for acute care, over 10%, 10.5% have COVID. You are at, I have to move because it's blocked, 94% for ICU, 35% have COVID. Your ICUs are on fire out there. And, you know, acute care is not in good shape. At 94%. The other thing too, full is not 100%. Full is 98%. And the reason you have to consider full at 98% is you have an emergency department. You have, right? People don't plan to get in a car accident. Most people, I guess people trying to break laws do, but most people don't plan to get in a car accident. Most people don't plan to have a terrible injuries from domestic violence or crime. Most people don't plan to get into an industrial accident. That's why I say 98% is full, because if you don't have that 2%, then you can't take anybody in your emergency department. You have nowhere to go. You have nowhere to put them. And I know there's probably some people in the comments going, my hospitals, yeah, I get it. There are some hospitals in Washington State that are at 120, 130, 150% capacity. I've seen the numbers. I totally get it. There's other hospitals that aren't, and the coordination center is kind of kicking in to try to move people around. And there's some factors making it much harder to move those people around. Northwest, that's the Olympic Peninsula. You're in trouble. There's just no other way to put it. Acute care is at 95% occupied, 14% have COVID, and your ICUs are at 92% occupied, 22.5% have COVID. The Northwest, the Olympic Peninsula hospitals have been absolutely on fire for months. My heart really goes out to the hospitalists there. I can't imagine what it's like to be working and the patient volumes that they're seeing there. Puget Sound, King, Pierce, Snohomish County, Bellevue, Seattle, Everett, Marysville, the military bases, both up in Snohomish County and down in Pierce County, and Tacoma. Acute care is at 95%. Acute care is at 96%. COVID patients are just under 20%. ICUs are at 91.5%. ICU with COVID is at almost 19%. This is what I mean by at 98% you're full. The hub hospitals for the state of Washington, King, Pierce, Snohomish County, this is where the biggest hospitals are located, are almost all full. This hasn't started. That's the thing. We haven't even started. We're in the second inning of this baseball game, maybe the third. And right now, it's Washington State 3 and the Omicron's 92. South Central, Washington wine country. Love it out there too, just not with the COVID. 87.3% in acute care, 12.3% with COVID, over 91% ICUs, 16% with COVID. You're stressed. Southwest region, that's Clark County. That's down southwest corner of it's not just Clark County, it's Cowlitz County and Klickitat and Skamina. I always have a hard time with that one. I speak perfect English, and yes, I'm a transplant to Washington. I always say it's the mouth of the Columbia River counties. 86% in acute care, 14% with COVID, 72% ICU, 23% ICU patient load is going up. The best region right now is that region, that Southwest region, but there's big problems in Clark County. Going to talk about that. Reporter from KOIN, I didn't catch her name. You did a good job today on the Washington State Department of Health. You asked the right question. You held their feet to the fire. I was amazed. I don't remember your name. Whoever you are, you did an amazing job today. The West region, so that's Olympia and the Pacific counties, the Pacific Beach counties, 94% acute care in use, 19% have COVID, 94% ICU in use, 34% have COVID. Our hospitals are in trouble, and we haven't even started. I'm going to talk about case rates. I'm not going to read it like in all the painful detail that I did here. It's real simple. Every region that I discussed has extreme transmission. There is one county in the entire state, it is in Eastern Washington, that has low transmission. It's only going to be for a day. It's a test anomaly. In the last 7 days, nobody has tested positive there, probably because no one has gotten tested. It's a very, very low population county. There is one more county that has substantial transmission, the entire state of Washington. After that is high. So high is from 100 to 199 per 100,000, 7-day moving average, or extreme. Extreme is over 200. I do want to call out a couple of areas. A big thing that's happened today is that where Eastern Washington has been lagging behind Western Washington, that's evaporating fast. East region, so that's your Spokane, Northeast, you're at 402.5. I think you went up almost 100 in a day. That North Central region, you're up to 415. South Central, I have a lot of people from Washington wine country. I noticed that. Lots of Yakima and Tri-Cities. Hello, wine country. 474. You've been following the dates and you know that's just like, it's just going off now. Puget Sound appears to be topping out around 700. We're going to have to wait to see next week. Is that where it's going to crest? But if Puget Sound, with the vaccination rates they have, tops out at 700, I think we could see whole hospital, not counties. I think we could see whole hospital regions, 7-day moving average, getting into 1,200, 1,300, 1,500. And I think we could see that by the end of next week or the week after. This is the bad news. This is the bad news. I don't pull punches. Don't talk to a narrative. I talk to facts. And I'm going to share some facts about King County data that's come out today. On December 23rd, King County, the reason that people are obsessed with King County in the first place, like you may have noticed, like Trevor Bedford is, you might hear other people talk about King County. We have excellent data here. We have excellent test programs. We have excellent data. We have excellent dashboards. We have a ton of experts. This is a great area to study COVID. And on the King County Public Health website, they created a scorecard that I know was passed around a lot. Like, hey, wow, check out the scorecard. And some other counties now have adopted it. And what it is if you're not vaccinated, what is your risk of getting COVID? If you're not vaccinated, what is your risk of getting hospitalized? If you're not vaccinated, what is your risk of taking a dirt nap? And I don't say that to be disrespectful. I can't see the other D word on the TikTok because it's a little Orwellian here. On December 20, now this is over 30 days. We're looking at 30-day window. On December 23rd, when Omicron is just really starting to ramp up here, you were 6 times more likely to get a COVID infection if you were unvaccinated. You were 40 times more likely to end up in the hospital if you were unvaccinated. And you were 44 times more likely to go yeet if you were unvaccinated. That was the data from December 23rd. We're going to fast forward 10 days. I know people that are watching on the other channels, their jaws just fell in their lap. People on TikTok, I'm going to give you the numbers. 10-day change. If you are not vaccinated, your risk is now 2.4. If you're not vaccinated, your risk is now 13 instead of 40. If you're not vaccinated, your risk of mortality has 27 instead of 44. This is crystal clear evidence. There is a lot of vaccine breakthrough. And it is taken a significant bite out of the cases because we went from 6 to 2.4. It's taken a significant bite from hospitalizations, and it's almost halved mortality. What we don't have in this data, which is really critical to understand, we don't know boosters. What we are hearing is, but it's anecdotal, and what hospitalists are saying, when it comes to people in the ICU, they're not seeing people who had boosters. If they're seeing if they're seeing a person in the ICU at a booster, they're multiple comorbidities, very elderly, they were at extreme risk. This is a lot of evidence. This is real data, real-time data. I'm exhausted. I think most people watching this are exhausted of COVID. I know I am. I know 2 years of covering this has really taken a toll on me up here. And when people get tired and frustrated and over it because it's our human nature, we let our guard down. And there's been this narrative. It's cold, it's mild. And I and other medical creators and other people are like, oh, slow down there, partner. We don't really fully know about that. And I think I've presented a good case tonight. It's not mild. And you can't let your guard down. Not for a minute. Because numbers don't lie. Real numbers don't lie. I mean, yes, if you just make up numbers, they lie. But real numbers, steeped in science, peer-reviewed, real-time data, they don't lie. If you're letting your guard down, you're making a big mistake. You haven't got a booster yet, you're making a huge mistake. And I'm going to roast the Washington State Department of Health. Don't worry about that. That's coming. Next chart just to show, which reinforces. We showed this same chart 10 days ago, and on that chart, what we were seeing was the unvaccinated was just skyrocketing, and there's just a little tiny line for the vaccinated. Now to 10 days, it's still more than half the rate, right? 2.4. So it is significantly higher for the unvaccinated. And there's not a lot unvaccinated in King County. Only about 20% of the total population, not eligible, total. We're about 81% vaccinated. We have really good vaccination rates, including for the 5 to 11-year-olds in King County. So the percent, right, there's the percentage and the numbers, but then you have that relative risk. The relative risk is still significant. 2.4x is not chump change, but it's not 6. And I think the message here, because nuance can get lost, let me be very direct. If you're walking around because you're vaccinated and you're my age or younger and you think you're super person and I don't need to do anything, you're operating with the wrong lenses. And believe me, I hate wearing a mask. I hate it. I hate timing going to the store for when I think there's less people there. I hate that Dr. and Mrs. Malcontent and I can't get on an airplane and fly somewhere we want to in the world and go visit for 2 weeks. Not in part just because of COVID, but because if we plan the trip, that nation could become a COVID dumpster fire by the time we go there, and they may not be letting Americans in, or we could be a COVID dumpster fire, and we might not be able to fly out. Or there could be an insane person on the airplane that's going to be screaming about their rights and freedoms for 6 hours, and I'm going to have to sit there and behave the whole time, which Dr. and Mrs. Malcontent knows ain't going to happen. And then you'll be reading about me in the news. And I'll have stainless steel hardware to brag about. I'm tired of it. I get it. I really do. I would honestly, tonight, I would really prefer to be talking about the insurrection. We did almost 16 hours of continuous coverage on the insurrection last year. We interviewed amazing people afterwards, people that were there, shared their pictures and their story. I would have loved to have recapped this. I'm tired of this. But this is our reality. All right, King County. I'm going to keep talking about this. As you can see on the chart, if you can't see because you're on TikTok, the hospitalizations, they're going up as a line, and they have not decoupled from cases yet. The hospitalization line and the case line in King County are going like that. They have not decoupled. 76% increase in hospitalizations in the last 7 days. 96% of the acute care beds are occupied in the hospital region. And COVID cases are increasing at 76% a week. Do you capiche? Do you get, I can say capiche, I'm 25%. I'm Italian Jew. My mother was an Italian Jew. The Jew part's from Russia. I was raised on violent guilt. So I can say capiche. It's kind of nice having the Italian and the Jew thing, because I can then say, it's like, no, I have the hall pass. I can say that. The other thing that's going on, which we're seeing because of these vaccine, right? The number of, the percentage of people, the slice of people who are vaccinated coming into hospitals, we're seeing the gap close between the previous, before Omicron arrived, and after Omicron arrived. And now in Washington State, where I was pretty enthusiastic 10 days ago, I was like, wow, we're mirroring, like, these numbers. We look at our numbers are just like the UK. And when we look at the hospitalizations rate, our numbers look like Gauteng. And this kind of makes sense because we're much higher vaccinated, which makes up for the fact that we're older and unhealthier here. So maybe that's balancing out. We're like at 28%. So we've lost. So before it was like an 80% reduction with Omicron for hospitalization. Now we're maybe 70, 65% reduction in 10 days. And it's just getting started. And it hasn't really hit the low vaccinated half of the state yet. I told you it was not a lot of good news today. All right, so let's get into the math. What's the baseline? There's been 913,980 cases, 46,752 hospitalizations. That's since January 20 of 2020. We were first. I'm tired of Washington being first. 5.16% of all confirmed COVID cases in Washington State have ended in a hospitalization. 1.2 is the estimate for hospitalization rates in King County. When we talked about this last time, it was 0.87. It's gone up a lot. And the percent of people get hospitalized has shrunk. So the relative risk of getting hospitalized is climbing. In Eastern Washington, unvaxxed areas, this is going to be way worse. So on January 6th, 1,493 hospitalized COVID patients, 506 acute care beds left in the state, 127 ICU beds left in the entire state. Washington State, 7-day rolling average, new cases 8,410. We are now logging 215 new hospitalizations a day, 7-day moving average. That's 1,505 hospitalizations a week. And based on the relative risk, that is 813 hospitalizations. That won't be the mild, short hospitalization version, more than 2 days. If you're looking at the slides, you can see the numbers and you can do the math. We're in huge trouble. IHME has tweaked their forecast. They are now predicting 38,000 cases a day, peak on February 4. That's 400% more cases, 300%, sorry. It's 300% more cases than where we are today. 38,000 cases, and 1.2% of those will end up in the hospital every day by the end of January. It's not going to work. Square peg in a round hole. And I'm not being alarmist. I am not here trying to scare people, because the Washington State Hospital Association sounded the alarm today. I started with a quote. We have never been closest to crisis standards of care. Washington State Hospital Association sent a letter to Secretary of Health Dr. Shaw and Governor Jay Inslee. This is what they have asked for. They have asked, one, for Governor Jay Inslee to declare a statewide crisis. The hospitals are essentially out of options. Why don't they stop elective? They have. They have just about already stopped elective surgeries. They did it pretty quiet. They don't have that anymore. It's used up. They want to increase incentives to long-term care providers, financial incentives for them to take a patient who has COVID, who has recovered to the point that they don't need to be in an acute care setting, but they haven't recovered to a point that they can go home. My mother went through this. I went through this with my mother in 2020 before vaccinations were available. She had to be transferred over 250 miles away because that was the closest facility that could take her from where she was at. And we don't have enough beds. Right now, we have about 84 beds for accommodating this. This is what was said in the Washington State Hospital Association briefing today, and about half of those beds are in use. Third thing they've asked, increase the budget for the Department of Social and Health Services to immediately hire more caseworker staff. Now, why do they need that? One of the problems is you have a patient's got COVID in the hospital. We're ready to release the patient, but we have to evaluate where are we going to not release them home. They have to go to a rehab facility, occupational therapy, long-term care facility. Maybe they're completely disabled in the ICU. They're not going to fully recover. They've recovered to the point that they've beat the COVID. Their life is never going to be normal. They're never going to go home again. Maybe they have brain damage, hypoxic injury, right? A social worker, a caseworker from the Department of Social and Health Services needs to evaluate the case and decide what is the best facility for this person. There are so many people that there's a medical term for them. It's called a gomer, as in Gomer Pyle. And there are so many gomers that there is a huge backlog for them. And there's not enough of these caseworkers to do the evaluations. And so this is slowing things down. Immediately address barriers to assign guardianship for patients ready for discharge from acute care hospitals. Apparently, here in Washington State, our laws are a dumpster fire for this. And to be candid, I don't know enough about it. I just know it's a big problem, and it's very, very challenging, apparently, for a family member to come in when they have a legitimate ability to do guardianship and get guardianship of an individual. And if that can't be done, there is no fast track way to kind of move these through court. There's one person, they said there was just one. They've been in the hospital 100 days. They've been ready to be released. 100 days. There's nowhere to put them. So they're just in the hospital. And then because they're in that hospital, even though they're ready to go home, they still got to wake them up twice a night to take their vitals. They're still eating the food. They're still using up all those resources. And then they are exposed to potential infection risk, not just to COVID, but, people get infections in hospitals. It happens. And the last thing they've asked for is the immediate deployment of the National Guard to assist with staffing shortages at long-term care facilities and hospitals, particularly in support roles. So not in medical roles, but in support roles. So think of that as engineering and facilities, dining and meal prep, sanitation, not patient triage, but more than the help desk, but not actually doing patient care. That's what the Washington State Hospital Association has all but begged for today. I'm going to pause for a minute because I want to roast. I'm roasting her on the ticker. Hi out there. Facebook, Twitch, YouTube. Go ahead and spam those hearts again. Go ahead, spam those hearts. Let those mods and admins know what you want to do. Brandy Cruz, who left Fox 13 and is clearly, if you follow her on Twitter, has clearly been embracing the anti-vaccination rhetoric today. Brandy At the exact same moment that the Washington State Hospital Association was basically saying, we're on the brink of crisis standards of care, was praising Aaron Rodgers on Twitter, literally at the exact same moment. I always suspected she was awful. I just didn't know she was that awful. Multicare Hospital Network. If you're in Western Washington, listen up. They have moved to the CDC crisis staffing standards. So what does that mean? The CDC crisis staffing standards is you work at a hospital and you got the Rona, and you may even be mild or moderately symptomatic. If the hospital says we need your ass to come in to care for patients, and that's what they're doing at Multicare. This could potentially include Mary Bridge Children's, Multicare Allenmore, Multicare Auburn, Multicare Capital Medical Center, Multicare Covington, Multicare Good Samaritan, and Multicare Tacoma General. There is always a challenge when an organization is transparent. There's this urge to punish them. How dare they do this? The reaction needs to be balanced. The honesty, the frankness, when they were in the Washington State Hospital Association briefing today, should be commended, and it should be embraced. And my counsel to you is, if you or a loved one is severely immunocompromised, you're an organ transplant, you're a cancer patient, and you have something non-COVID going on, and you're thinking about going to the ER, and at the end of the day, if it is so urgent that it is yeet, or for the love of God, go to the closest ER. I'm not giving out specific medical advice. However, if it is something that is less emergent, and you can go to another facility that's maybe not Multicare, at least in the very short term, you may want to consider that if you fall in that category. If you're a raging COVID patient, it doesn't make any difference if the person caring for you has COVID, right? I'm just saying this is a very narrow, specific group of people. And here's the other thing. I know because people were asking when we brought this up before. Not in Eastern Washington. And they said not yet. That's the word they use, not yet. And I'm telling you, other hospitals are going to be tipping over, and it's going to be tipping over sooner than you think. Staffing shortages, I want to address this. They are not because of the vaccine mandate. Every now and then I see this come, well, they haven't fired all the nurses. This has been building for years. It's got nothing to do with vaccines. Private equity has taken over a lot of hospitals. Nurses and doctors have been quitting for years. They've been quitting over patient ratios as nurses and revenue requirements as doctors. Well, you didn't do that surgery fast enough, and because you didn't clear that operating room, we didn't get to do the next overpriced surgery procedure that we set up here in our private equity actuary tables. And so shame on you, doctor. Yeah, that's the state of healthcare in the United States of America today. And by the way, hospitals lose ridiculous amounts of money on every COVID patient they have. They lose money. Hospitals make money on elective surgeries and day procedures. Those are the big money makers. This has been going on for a long time. Then you've had a bunch of nurses and doctors and respiratory therapists quit because they're tired of 2 years of anti-vax BS. They're tired of it. They're tired of saving their asses. They are tired of working on people that they're trying to save their lives being told, I have sudden onset lung cancer. I swear to God. This was a thing. This was a thing. Sudden onset lung cancer. 98% of Washington state nurses got vaxxed or got their exemptions. Over 99% of doctors got vaxxed or got their exemptions by the October 18th deadline. And rural hospitals out in Eastern Washington, what do you always talk about? Because that rural hospitals are over in Eastern Washington for the most part. Yes, there's some down in the southwest part also. Those rural, they were a lot more lax on the exemptions, particularly religious. Sure, religious exemption, whatever, go back to work. That's going to bite them in the ass here in a couple of weeks. So the other thing is, we have receipts on this if you want to call us out. The availability of staffed hospital beds actually went up in November, not down. If we had lost staff because of a mass exodus over vaccine mandates, the number of staff hospital beds available in the state of Washington would have gone down, not up. And they went up. I said down by accident earlier. They went up. We have receipts. So what's Olympia doing? All right, malcontent. David, you just told us the whole state's on a COVID fire. We're in the express elevator to hell going down. One of my favorite movie quotes. What's Olympia doing? Well, we've ordered 5.5 million more rapid tests for the state of Washington. There's 800,000 already distributed. Another 2 million should be here this week. This weekend's tomorrow, but that's what they said, should be here this week. Distribution for those test kits will be through schools and local health departments. Care, Evolve, and Amazon are working on building an app, a web portal to help you find and go, yes, I would like a couple of tests to take home. That's going to get a couple of more weeks to set up, a couple of more weeks. We're already on fire, and the fire department's going to come here in about 2 weeks with tests. And of course, everybody is going to be completely honest with their test requests in this distribution. I am sure that Care, Evolve, and Amazon will have figured all of the possible ways that people could abuse this particular system and not over-order tests to then sell them for a few $100s each on the private market, or make silly TikTok videos destroying them testing orange frickin' juice. They're going to expand, they have expanded the capacity at the FEMA vaccination site in Auburn. They're now able to do 1,500 doses a day. Can you tell I'm underwhelmed? Can you see this on my face that I am underwhelmed by this? They're opening another mass vaccination site. This will be in Northwest Washington, so I presume the Olympic Peninsula. No ETA on when that's going to get opened. We've ordered 10 million masks for distribution in schools and to local communities. No ETA on when those masks are going to show up. I mentioned a reporter today on COIN, and I think that she did an amazing job. There was also a reporter from Como, and not a big fan of Como because of Sinclair, and both of these reporters asked tough questions. Apparently, according to COIN, this reporter in Clark County, mainstream media was advocating for you today, by the way, Clark County. I know a lot of you down there don't appreciate the media at all. It's like, there is not a single state or county site to get vaccinated in Clark County. There's nowhere to get a test. And the response from Dr. Shaw was, well, we have vaccinations in Auburn. Go look on a map on where Vancouver, Washington is and where Auburn, Washington is. Oh, and by the way, we're having historic flooding right now. And by tomorrow evening, you probably won't be able to drive between Chehalis and Centralia on I-5 or any of the other roads because you're going to be underwater. But that's okay. You can drive to Auburn if you want to get that. And as far as tests, well, it kind of sucks to be you. I mean, he didn't say that. And they're probably going to tear up my press access for saying this tonight. And the same issue was brought up by Como for people in the Puget Sound area. No one could find a test. It's near impossible to get a PCR test. You can't find tests in stores. People can't find booster shots. And there's hard evidence if you don't have a booster shot, you're a lot more exposed to Omicron than what we probably realized. I know this was eye-opening for me when I saw this today. And the same thing. Well, you should have bought them. They should be like Band-Aids. I love the C thing. They should be like Band-Aids in your medicine cabinet. That's what they said. Oh, and let's not forget, Walmart and Kroger just raised the prices on those tests. Now, you, of course, can go and buy them with your own pocket and then submit for insurance reimbursement, and I'm sure they're going to be right on getting that check to you. The reason I'm so frustrated, the reason I'm so angry and disappointed and emotional, I wrote about this on October. You go to our website, malcontentnews.com. I need water. I wrote about this on October 20th. I wrote what was going to happen. Now, I thought it was going to be Delta AY4 too. Freely admit, Omicron didn't exist then, and Omicron's made it all even worse. If we could see it, if it was so crystal clear, why did we do nothing? And we did nothing. This is directed at local governments, county governments, state governments, and our federal governments. Our country is on COVID fire. We did nothing about it. We're letting this happen. And our hospitals are going to pay the price. And then we're going to pay the price for years to come. So what's the Washington State Department of Health say? Get vaccinated. Good luck finding. Get a booster. Good luck with that. Drive. You can't drive over the mountain passes to go to Eastern Washington. They're completely all closed to at least till Sunday. You can't head south down past Pierce County probably because a lot of those roads are going to be under water tomorrow. So if you drive, do it during the daylight. Watch out for the flooding tomorrow. Get yourself some home tests. If you feel sick, assume it's Omicron. And if you can't get tested, just stay home. Don't expose anyone. Don't go to urgent care or the emergency room unless it's a true emergency. Now, this one is important. A couple of things here I want to talk about. Number one, don't go to an emergency room or urgent care looking for a COVID test for prophylaxis. Well, I want to see if I was exposed or because of travel. Don't. They're overwhelmed. They do not want to see your happy ass in there. The other thing that they appealed, the Washington State Hospital Association appealed today. There are apparently physicians in the state of Washington. They didn't say what part of Washington. I can probably guess. Clark County, excuse me, a little something in my throat there. Wenatchee area, sorry. Little thing in my throat. They're telling people when they're testing pot, you need to go to the ER and get yourself some monoclonal antibodies. They don't have any I went through the numbers. There aren't any. There are no monoclonal antibodies. And someone like me is not getting monoclonal antibodies. If you remotely look like me, hopefully better, but if you remotely look like me and you don't have underlying major comorbidities, you're probably not going to get monoclonal antibodies anywhere. So we don't have it. Don't go to the emergency rooms for non-emergency stuff. Don't go to urgent care for non-emergency stuff. They're overwhelmed. So what can you do? Yeah, I know I'm going to be a hypocrite right now. If you're not vaccinated, get vaccinated. One dose is better than no dose. Good luck finding it. This is a lot more addressed to like Southwest Washington and east of the Cascades and Washington wine country and the Palouse, because your vaccination rates are low out there in the east slopes of the Cascades. If you're thinking about it, just please, just Pfizer or Moderna. The J&J is a no. That's a nope. If you're eligible for a booster, this is urgent 911. Get your flippin' booster. The booster's keeping people out of the hospital. It's keeping people out of the ICU. Showed the evidence. I showed the data tonight. Two shots, 6 months or later is not cutting it. Single J&J. Again, 16.2 million people in the United States have got J&J, only 3 million boosted. What? What are you other 13.2 million people waiting for? You can't tell me you're vaccine hesitant. You got the J&J. Go get the Moderna. Go get the Moderna over the Pfizer if you're good evidence. There's good evidence that J&J plus Moderna. Don't get a second J&J. Wear a KN95 or an N95 mask. If you can't afford them or if you can't find them, cloth mask with a surgical mask. They typically have those surgical and exam masks right at the stores here in Washington State. At least I know Eastern Washington. Again, I know. You're like, hey, come over here. People don't even wear masks. We know it's a rule. I know. I don't know what to tell you. Plan your grocery trips. Kind of try to do that outing once a week. That's it. And you really need to be preparing for school closures and you need to be preparing for supply chain disruptions. I'm going to talk a little bit more about that. And then the next thing, do not panic. I started this tonight with a quote from Marie Curie about fear, and we're going to have another quote about fear. Do not panic. This is not the apocalypse. It's certainly not good. And I will firmly say, for the rest of January, February, and probably most of March, this is not the time to get into, say, a really bad car accident, or find out you had cancer, or get in an industrial accident, or have a heart attack, or a stroke. This is about risk mitigation. And it isn't, look, you can just be, I'm not afraid of the Rona. I'm not afraid. Yeah, when people say that, it means you are afraid. But again, that's projection, and I'll leave that up to a psychologist to talk about, because it's not my lane. Fine, don't be afraid of it. But this isn't the time to be shooting at 200 pounds of tannerite packed into a riding lawnmower tractor at 100 meters. This would be a very bad life choice right now, okay? I'm trying to speak your life. Yes, I do like the 2A. Yes, people like me. Yes. Oh, yes. Boom, boom, bang, bang, pew, pews. Surprise. This isn't the time to do this. This is not the time, I know I'm an intermediate skier, but I think I'm going to try Black Diamond for this is not the ski season to do this, okay? That's what I mean by risk mitigation. Let's talk about masks. N95, KN95, KN94 masks protect you from this, but what they mostly protect you from is not coming in, it's going out. That's what these are for. This is not necessarily about protecting you. It's about protecting the people around you and keeping this little guy from going right into you. Don't go to Amazon. Almost 60% of the masks and tests and evaluation have been done that you buy from Amazon are counterfeit. If you are going to buy from Amazon, do not buy from Bob's House of Masks. Buy directly from Amazon or from like a really, really trusted seller. And, well, it says 3M. No, we'll read the fine print because people spoof and da-da-da-da. It has 2,000. Look at the reviews. Because sometimes you might find reviews for flat panel TVs mixed in there because people will sell something else, get the good reviews, or pay people to write good reviews, and then they change the product to something else and sell something totally BS. I have experienced on more than one occasion counterfeit medical devices bought from Amazon. I will never buy from them again. So, full disclosure. Second disclosure, I used to work at Amazon. So 2 journalistic disclosures there. We recommend projectn95.org. They are nonprofit. They don't sell counterfeit goods. They verify who they are working with. Projectn95.org. Cloth masks don't cut it anymore. They never really did in the first place. A couple of people, if you're on malcontentnews.tv, if you're on YouTube, you're on Facebook, if you're on Twitch or Twitter, you're seeing slides. If you're watching us on TikTok, you don't see slides. I've had a couple of people send me this chart. Go, is this chart legit? Is this real? It's the chart on how quickly can COVID spread if your mask or if other person's mask, what mask they're wearing. Yes, it's legit. However, it's from spring 2021. So this does not account for Delta, which was more transmissible than when this study was done, and it doesn't account for Omicron. So I would cut these times down. And basically, because you don't see the chart, I'm not going to read off everyone, but 2 people standing face to face with no mask, and one of them's got the Rona, and we're talking like this, in 15 minutes, the other person got the Rona. If you got 2 people wearing N95 masks and not even properly fitted N90, a lot of people wear them wrong. I see lots of people, they just put on the one strap because I know they're uncomfortable as you know what, and I get it. You got to use both straps. But apparently, if you're wearing an N95, and if you're wearing it wrong, I don't mean nose sticking out, and the 2 of you are talking to each other, and you both got N95, 25 hours. You'd be in the same room. Well, that'd be pretty awful, wearing an N95 mask continuously for 25 hours. Cloth masks only give you a few more minutes over nothing. So nothing was 15 minutes. Cloth mask gives you 20 minutes. That's it. They don't cut it. And I know what the CDC said 2 years ago. And I know long-term malcontents who have been watching this from the beginning know all the way back in late March when the first study came out from the University of Nebraska saying that COVID was airborne. And we ran with that study, and because it was an extremely well done study, and the disease dynamics supported it was airborne, and boy, did I take a lot of heat for using that study. It's airborne. We were wearing masks when we flew to Africa in February of 2020. We wore N95 masks, both at SeaTac Airport on the plane and through all the airports we connected through. Except for when I was asleep. There was one flight, it was an overnight. That wasn't happening. Which then, of course, probably made it pointless in any other environment, but at that time it was fine. Why were we wearing masks all the way back then? Because we were pretty convinced it was airborne all the way back then. That's why cloth masks don't cut it. Well, the N95 work because it's still attached in little tiny droplets. It's not a little unencapsulated little 0.1 micron virus. It is still encased in a little bit of mucus or spit when it's going out. And an N95 mask has an electrostatic charge. That is this NIOSH. This is the special manufacturing. And so you have the tight weave, the electrostatic charge that acts almost, you know how like static cling? It kind of acts a little bit like static cling when the little virus droplet is like, I'm coming to get you. I'm coming up. I can't get you. Curses, N95 mask foiled again. Children in schools. Staff is becoming sick rapidly. I had said in a post here in Washington State, North Shore School District, I'm sorry I said this out loud because I said this out loud. And then we went to go look at the data, and like their website was almost crashed. We couldn't even get the friggin' dashboard to load. I'm like, great, we just sent a whole bunch of people to the website. Sorry, North Shore School District. And I'm just going to make it worse again. Go look at 2 in the morning, okay? North Shore School, they do pool testing of the entire student body. They have a diverse group of students that are across 2 counties, in both highly vaccinated and not so highly vaccinated areas, and they're transparent with all the data, and it is updated daily. So, and I have said, where North Shore School District goes, the rest of Washington is going to go. North Shore School District has 229 students with COVID. There's nothing even close. And school started there on Wednesday. Because Monday was weather. Tuesday was weather. Wednesday, I think, was a 2-hour delay for them. So they've had 2 days of school, and they already have 229 confirmed COVID cases. There are 494 students quarantined, close contact, and there are 40 faculty members out. So students are getting sick and staff's getting sick. So you know what my view is? I don't think you really have to worry about the kids in school in another couple of weeks because there's going to be so many people in Washington State at the schools, both faculty and students, that are sick that they won't be able to pragmatically have school because there's not going to be enough people to teach and there's not going to be enough asses in the seats for the people that are left over to teach them because everybody's going to be sick. So, and I would say, probably not going to have remote learning for the exact same reason because everybody's going to be sick. If you're a parent, you got youngins, and this probably just doesn't apply to Washington State, you should be having a plan in your head. What happens if my kids find out tomorrow my kids are going to be at home for 2 weeks? You need to be figuring out those plans. I'm not saying it'd be scary. This isn't scary. This is about being prepared. This is about being ready. That's what this is about. Supply chain and services. The UK government has told businesses to prepare to lose up to 25% of their staff when things reach their peak. By the way, UK is taking the same approach to the United States. We give up. We're just going to let it burn like a dumpster fire. We give up. You're on your own. You're not me. Hospitals, too bad. You're going to collapse, whatever. Suck it up, buttercups. They've told them we have no such guidance from the Chamber of Commerce or the U.S. Department of Commerce. We have no such guidance from them. But UK has told them to prepare to have 25% of your staff out sick. Think about where you work. Think about where anybody works and how stretched thin you are, even on good days. Now imagine if 25% of the people couldn't show up for a couple of weeks, right? Because it's cycling through. It's not that you have 25% of people that are out for 2 weeks straight. It's you'll have this 25% that's out for 4 days and another 25% out for another 6 days, all right? And just imagine where you worked. What would happen if 25% of the people couldn't show up? Everyone should be expecting supply chain and services disruptions in February and March. Everyone. Rural areas may get hit harder, ironically, because you are further on the supply chain line. It's one thing, and by the numbers, because capitalism. Isn't capitalism great? Because of capitalism. If I'm a distributor and I go, okay, I have this county and it has 4,000 people in it, and I have to decide, am I going to have my truck driver drive to and we have counties here in Washington State with 4,000 people, and I have this one last healthy truck driver for 7 routes. Am I going to have my one last healthy truck driver drive to the county with 4,000 people, where I'm going to make money on selling goods to 4,000 people, or am I going to send him to the county with 400,000 people? Come on, capitalism. Rural counties are going to really feel this. This does not mean to go to the store right now. Oh my God, I saw this guy on TikTok. I have to go buy every roll of toilet paper I can get because of this. Panic. No, it's not what I said. I said you should be prepared for supply chain disruptions. What does that mean? That means having a few days of Campbell's soup sitting, which you should have anyway, because of earthquakes, tornadoes, hurricanes, floods, blizzards, dust storms, whatever. You should have a stash. Like most people have a stash. Go look at the stash. Is the dates on your stash like, oh wow, this soup's 7 years expired in my stash? Some of you still have garages full of toilet paper. I know it. I'm never going to use up all this toilet paper. I don't know what I was thinking. I lost my shit for a minute. And I got a box truck and I filled it up with toilet paper because I thought that's what I needed to get prepared for the Rona. If you got medications, reach out to your doctors and see if you can get a refill early. This is the kind of preparation I'm talking about. You have pets, make sure you've got little extra, especially by the way, in the comments, both sides, cat food. This is the one thing that I've been seeing consistently with supply chain. Is this a Western Washington thing? Is this a national thing? Holy crap, cat food. The cat food aisles are positively Soviet, and it's been that way for a while now. Is this a thing? Time to replace your Y2K food stock. Exactly. Getting cat food has been hard. Okay, so I'm seeing comments on both here, what's up with the cat food? It's crazy. Every time I go to the store, I'm buying 10 cans, literally, because he goes through 2 cans a day. I'm buying 10 cans of cat food because we build it up his stash for the supply chain disruptions. When I talk about services disruptions, our heater broke. Our heater broke. It broke at a really crappy time, too. Fortunately, because we have a heat pump system, we have an emergency heater for when it gets really cold. So we were able to switch over to the emergency heater. So we're very fortunate. We're not able to get our heater fixed for weeks. Now, admittedly, if I could not, if I'm told I had to live without heat for 3 weeks or 4 weeks, I'd be like, that ain't friggin' happening in Seattle in January. We got to figure something out. Something. That's the kind of stuff that I mean by services might be delayed. Might be having a hard time getting parts. Western Washington, and I say Western Washington broadly, so Pierce County north to the Canada border, and Olympic Peninsula and Pacific Coast counties, we may be in for even a little rougher time because of the weather situation. I'm going to talk about the weather situation on the other channels. I'm not going to bore you TikTok with our local weather situation out here in Western Washington. It's bad. All right, we're almost to the end, and then I'll be able to take your questions. So mods and admins, you can go ahead on the chat for Twitch or Facebook and go ahead and start funneling me the questions over there, mods and admins, if you're on cross-platform. I will try to look for them on TikTok. It's the type is really small. Trevor Bedford has this quote, and it's really prophetic. It's from December 17, where he said, Omicron makes things significantly worse. We could have wave evolution. I'm quite worried in 9 more months we'll have both Omicron and Delta circulating, and Omicron's not going to get us out this. The future is very big numbers of cases each year with a smaller number of severe outcomes, and it is something that, as a society, we're going to have to learn to live with. But we just can't say F it. German health minister, John Spa. Germans are very direct. Germans will be vaccinated, cured, or dead by the end of winter. He really did say that November 22nd. Americans will be vaccinated, cured, or dead by the end of this winter. It applies. And the last thing, knowledge is the best tool to fight against fear. A wise person chooses to be informed so they can make sound decisions. A fool is controlled by ignorance where fear loves to grow. I said that. All right, let's see the questions. TikTok is acting buggy, so I switched over to Facebook. Cats are smart like ninjas. Yes, they are. I agree with that. Let's see your questions. We have a months-long lockdown. No, they're not going to do a lockdown. No way. And I've talked about lockdowns. I've talked about this. The Department of Homeland Security, I can't say the T word. It's something that happened on January 6th. It was an act of, not patriotism, that doesn't start with P. It was an act of, not Trump, although that does start with T. It was an act of the T word. They did a bulletin back in middle November that said essentially that if lockdowns were to happen, that DV extremists would use this as an excuse to attack hospitals and government offices and try to have their little revolution. And so there's been a very clear message from the federal government that we don't want to have the inmates in the asylum get angry because it'll burn the asylum down. I hate it here. So yeah, there is no, close enough. That T word works. It's a different word. Why are we not stopping cruises? Capitalism. Capitalism. I missed the thoughts on schools. What I said on schools, another 2 to 3 weeks, 1, 2, 3, 4, 5 weeks, depending what part of the country you're in. Parents and teachers won't have to worry about schools because there are going to be so many students sick and so many teachers sick. They're going to be forced to close the schools anyway. So that's my view on schools. I saw something about masks. Should kids be in N95s? Yes. Straight up, yes. By the way, projectn95.org, I forgot to mention that. They sell child size N95s and KN95 masks. The KN95s have the ear loops. And I made a comment once and it was like, wow, out of context, that comment could really be used in the wrong way. I'm not a fan of the ear loops. I don't like the pull, but some people find them more comfortable. Cloth mask is a no, right? For the kiddies, it's what mask are they going to wear? But I would mask my kids N95. I'm also have white privilege and I also have a lot of financial resources. And I know it's not possible for every family. He's so woke. We groomed Gen Z. Gen X, like we didn't have enough. So we raised Gen Z like and they're gonna and we're gonna light the match. And I suggest maxing up and getting a vax or a booster. Yeah, I agree with that. Any news for vax under 5? Not necessarily my lane, but only thing I've heard is, June. It's not happening in this wave. Thank you, whoever Mod did. Thank you so much for projectn95.org. Yeah, Kent. I hear stuff in Kent. I know it's not good. There's going to be a lot of districts, and again, it's important. I really do. The remote learning didn't work. We didn't implement it right, for starters. It could work. We just did it all wrong. We did it all wrong, and that's a big part. But time out of the classroom, performance goes down. There's strong evidence for this. And I had talked about this too. There's an equity issue. In poor communities, in rural communities, there's equity with internet access. There's equity for computers. If you live in a household and you have 3 kids, and all 3 of them are in different grades and different classes, and all 3 of them need different computers to do at-home schooling. And then you need enough internet bandwidth for all 3 of them to be in Zoom meetings or in downloading and uploading without stepping on each other. And then that assumes that you, as the grown-up, aren't trying to work from home or remotely do anything on the internet at the same time. This is a huge equity issue. Because of capitalism. He's a communist. I just want equity. Oh my God, 30 new messages. Have I taken the DISC exam? I have no idea what that is. We need to free range them. Gen X, we are feral and free range. Just let them be free range kids. See, I'm the direct opposite. I actually operate really well from home. I guess I'm becoming more of a curmudgeon as I get older. Let me see here. What we got for questions on the other one? Lots of talk about Project End. When is Namibia coming out? I don't know. I really want to get the. Believe me, I want to get this documentary out. But when this COVID dumpster fire ends, is there really much difference between N95 and KN95? KN95 is the Chinese equivalent. So depends on the manufacturer, where it's come from. So maybe on paper, no. On paper, no. One of the big things is typically the KN95s have the ear loops. They don't have the as tight a fit. That is one of the differences. That's what we did. I see somebody commenting, I just got a big box of 50 and I'm still cranking them. That's what we did. Store them in a paper bag. Your mask, don't put them in plastic. You put them in a plastic bag. Any bacteria or whatever that goes, yippee! Warm, moist environment. If you put it in a paper bag, the air circulates. And so then you don't get yippee, warm, moist environment and crap growing on your N95. The other thing, I keep saying, the mask comes up all the time. And once again, you know what? I have a mask. Remember I said that our heater broke and we had somebody come out here? That guy yesterday had on the friggin' buff And he was breathing like Ron DeSantis at that press conference. So I've kind of walked, yes, so this is why I had an N95 in my office, and I'm like, if I don't get the Rona, it's going to be a friggin' miracle. All right, first thing, notice how I'm holding, right? This is an N95. Notice how I'm holding it. You don't touch this part. So you're going to hold it in the cup. You're going to get the straps. You're going to get them like that. You're going to pull it right over your head. Going to pinch the nose. You're going to do a big breath test. You don't want to feel the air going this way. It's not fitted. There you go. Take it off. Hand here. Straps up and over. Hold it in the cup. Put it in the bag. That's how you do it. That's how you do an N95. That's the doctor way. The other thing is that I didn't demonstrate, you should wash your hands before and after taking it off. If you want to extend the life of your N95, which is what I do, you can wear a surgical mask or a cloth mask on the front of it. That helps prevent droplets, the tiny little droplets, from accumulating on there, and you can extend the life. What I do for me, because I'm a little cheap. So what I do for me is, I have a couple, if the straps start they're getting a little, okay, muerta, that's number one. I did some wildfire coverage and I was wearing a N95 mask there. I took it off. It was just full of black smoke on it. That one gets dumped. Other thing I'll do is that nose part that I was showing, if I can't get that bend and get a good seal anymore, that's another one. It's like, it's done. And then the last one is if I could smell through it. If I'm like in the grocery store and I'm by the apples or the peaches and I'm like, oh, I can smell the produce. Red flag. So, I mean, look, somebody lets a 3-egg burrito fart go, you're going to smell that through an N95. But if you're kind of just smelling the world, then yeah, that means this guy might be finding a way in. Anyway, there you go, your mask demonstration. Does it no, color doesn't matter. Unless you're making a fashion statement, color doesn't matter. I don't know rate of hospitalizations on kiddos under 5. I do know we have record kiddo hospitalizations nationally, but I don't know the numbers specifically. I don't have the ear pierce like some producer could look that up on the internet and feed it to me. We were there for a little while. It was kind of cool. Then the Rona. Let's see what other questions we got here. I see lots of questions about masks. Lots of conversations about masks, dry run with H1N1, we learned nothing. Yeah, Stephanie making a comment about how we had dry run as a country with the H1N1 and we learned nothing. Very true. H1N1 came in. I remember I stood in line for hours to get my vaccination for it. There was no anti-vax. It was all very organized. Vaccines were just there. It was readily available. People were like, oh, heck yes, I want it. This got politicized. And now they've created a monster they can't even control. And this is going to be devastating to that side of the aisle. And I don't take joy in it. I don't. I don't like when people go yeet unnecessarily. There's going to be a lot of people who are going to go yeet unnecessarily. It's very sad. What's the issue with mRNA? I don't know. Wow. That's a doctor question. If you can't get the mRNA booster, but you can get a J&J booster, talk to your doctor. Talk to your doctor. I don't know. It's a tough question because the data is not really yay on the J&J shot, but I haven't seen a whole lot of research on Pfizer, Moderna followed up by a J&J booster. That's a doctor question. I can't answer it. Sorry. If you ever see Laughter and Light doing a live, might be a good Laughter and Light question. That or epidemiologist Cat, That's in their lanes. What is the survival rate now for COVID? It's always like the loaded question, right? Mortality rate here in Washington State is 1.1%. 5.1% of people who get COVID end up in the hospital. So, and 1.1% have gone yeet. That's since the beginning. So that's the rate here in Washington. There's other states like Florida have much worse rate. That's why I say it's kind of a loaded question, varies from country. Like, let's talk about South Africa, right? South Africa's survival rate is much better. Not even just up through the whole thing. Their survival rate is vastly better than the UK and the United States. Vastly better. We're having our asses handed to us because we let our divisions get in the way. Any good data on long COVID prevalence now? No. We need a lot more research on long COVID. We did a webinar, Malcontent News. We did a webinar. We had an amazing panel of experts on there. We had a lot of discussion about long COVID, and we had a couple of people experiencing long COVID on that panel discussion who shared their stories. But there's not a lot of research. I think this is something that we're not going to know for a while, for years, unfortunately. Public health should never be a political issue, damn straight. Absolutely. I mean, it's just like mic drop. Yep, totally agree. All right, so this is what we're going to do out there on TikTok land. We're going to talk about local weather because there's a big dumpster fire local weather situation here in Western Washington. No, wait, I want to hear about local weather. You can go to malcontentnews.tv. You can follow along there. We're going to be here about 10, 15 more minutes. We're going to talk about the local weather situation over there. TikTok, thank you so much for joining us tonight. Mods, admins, one more time, blow them up, blow it up for the mods and admins. They've worked really hard over there in TikTok land. It is not easy to have 200, 300 people in a live and manage their behavior on controversial topics. So blow it up with those hearts one more time. Facebook, TikTok, Twitch. You can use our emotes if you're a subscriber on Twitch. I don't know. Here on TikTok, you can throw one more little cool thing on my face or something here. I did already talk about schools. I saw this quick question going by here. My view on schools is in another 2 to 5 weeks, it's not going to matter in a lot of places because there's going to be too many kids and too many teachers sick to have school in the first place. So parents who are worried about schools, your worry should be shifting to what happens when they close the schools. I love the 80s sunglasses, Gen X forever. So I did bring that up, all right? And I talked about the North Shore School District in Washington State and some of their data and what they're seeing. And it's a good proxy to look at because they have excellent data and they do a tremendous job of testing the student body and the faculty body over there. So they're a good one to look at. So with that, I'm going to say good night to TikTok land. You can go to malcontentnews.tv if you want to hear about the weather. And with that, Malcontent out. All right. They've left the room. All right, let's talk about the weather. By the way, thank you so much, RH. Oh my God, thank you so much for this. I love this. Love you. All right, with that said, let's talk about the weather. Historic weather event is going on here. This is really similar to the weather event that we had in 2007. If you weren't living here in 2007, tonight's word is dumpster fire. It was a dumpster fire. We had all the passes closed. They were closed for days. And I-5 closed through Centralia and Chehalis. It was closed for days due to flooding and then some road damage that had to be repaired after the floodwaters receded. We are in near identical weather pattern. This is what we know tonight. All Washington passes between East and Western Washington are closed until at least Sunday. This has nothing to do with, well, they should have kept those unvaccinated drivers. Everything was shut down like this for days back in 2007. It is because there is so much snow, it is just too dangerous. There are avalanches, there are rock slides, there are trees down, and there is zero visibility. The rate of snow they are getting through the passes is incredible. And it's just going to take days to get them prepared, to get them back into a state that they can start having traffic again. The next thing I want to talk about here is the flooding that's going to be happening. It's already starting to happen. Pierce County, Thurston County, Lewis County, Mason, these counties that are kind of down south. I talked about Centralia. I talked about Chehalis. These areas are looking at, forget 2007. They're looking at 1996 flooding, which was worse than 2007. The Chehalis River had its highest peak in 2007. There's a couple other rivers down there that are going to peak even higher. Centralia is going to have its worst flooding since 1996. A couple of things. If you're in those areas, you get evacuation order. Don't be a friggin' hero. It's time to go. If you're in those areas, you got a level 2 evacuation order, or you wake up in the morning and you find out you have a level 2 evacuation order, I would recommend you leave. And I know level 2 is get ready to go in a moment's notice. I'm going to tell you why I would recommend leave. You don't want to be trying to leave out of a flood zone in the dark. Now, if you get a go order, your phone all of a sudden, like you get the text, level 3, time to go, go. But you don't want to try to evacuate in the dark with flooding. It's extremely dangerous because you can't see the water in the road in your headlights until it's too late. And because everything is just kind of flat in a plane, you don't know if that water's 2 inches deep or 20 feet deep. So, and you can't really tell how fast the water's moving unless it's violently moving. It's super dangerous. If you live in areas, if you lived in those areas in 2007 or 1996 and they flooded, or your neighbors who were there before, or like they've left, or they've sandbagged, or they're telling, oh, it's going to be bad, right? And you get that level 2, I would just go. Your life is not worth your things. Well, it's easy for you. Your life is not worth your things. And I just spent a lot of time explaining to you how our emergency services, our ambulances, our hospitals are stretched to the breaking limit. You have the hospitals in the state going, not we're to the breaking point. They're saying we are broken. Now it's just how bad will the damage get? Don't contribute to this. If you're told to go, go. If you have travel plans along I-5 heading south, like you're planning to drive to Portland from Seattle, Tacoma, no. Just no. You may get through it. The Chehalis River is supposed to be 2 feet below where it was at in 2007. I'm under the impression that it's not below enough to keep I-5 from flooding, looking at the historical data. I don't know how much was done from 2007 to 2022 to prepare for the next flood. This is amazing. It's supposed to be a 100-year flood. We're having them every 10 years. It's like this climate change thing is real or something. Cliff Mass. Sorry. Cliff Mass. Something stuck in my throat for a minute. I'm sure Cliff will write another amazing blog on how this is perfectly normal and within the realm of acceptable range of meteorological events, and that any suggestion that climate change could be contributing to any of the anomalies that we've experienced in the last 12 months is just pure fear-mongering and poppycock. Cliff! So, again, with that said, just don't. The challenge that we're going to have here in Puget Sound, if we have the repeat of what we had in 2007, where the passes are closed for days, I-5 South is closed for days, and we are cut off, essentially, from the rest of the United States, which is what that scenario is lining up. Our supply chain is already fragile. Distribution warehouses are already thin on stuff in those warehouses. So we could very quickly, in our area, see some supply chain disruptions because there just isn't a whole lot of headroom in the supply chain to deal with that. Here's the other thing that I'm really concerned about is this is going to have a dramatic impact on our ability to load balance hospital patients. People who are, say, down. Now, Clark County, Mesa, those areas, they're in pretty good shape, right? We went through those hospital numbers earlier. They're in good shape compared to the rest of the state. There's not a hospital region in good shape, but they are in good shape compared to the rest of the state. And they also, of course, have the option to go south to Oregon if they have to. Eastern Washington is cut off. Passes are cut off. Weather's going to be very severe tomorrow. Certainly, you're not going to get helicopters. So you're just down to airplanes, and you're going to have to be doing probably jet or turboprop aircraft that can fly or capable of flying high above the weather, which limits the number of aircraft that can be involved in moving patients around. So it's not happening at a good time. There is one silver lining in this. There is one good thing. It is going to slow down Omicron a little bit because the crappy weather and the road closures and the pass closures and the ski area closures are going to keep people from congregating. And it does separate Eastern Washington from Western Washington. And Eastern Washington case rates for now are still lagging behind. Boy, you're catching up fast. So it's going to help with the mixing. It's going to help with the spread. It's going to help with the close contacts. And so it helps pump the brakes a little. I in no way think it pumps the brakes enough. I don't think that this is the miracle we're looking for that's going to get us out of this dumpster fire. No. But it does, I think, give us a little bit of a tap on the brakes. Let's see. Any other questions? At least there's some good news. I know. This was a bad show tonight. I was like, I didn't even give my opinions on the insurrection tonight. We were going to light up a Holocaust troll tonight. We're going to write our story on that, and that story didn't go out today because of everything that's going on the COVID front. Get vaxxed. I know. You just said you can't find a I know. Get vaxxed. Make it happen somehow. Get a booster. Wear a mask. You can do that. Wash your hands. Socially distance. Grocery trips. Outside world once a week. Support our small businesses. I think you shouldn't be eating in a restaurant or a bar, but you can certainly get meals to go. Do takeout if they have outdoor dining that's covered. Certainly, there are some restaurants that have very nice outdoor dining areas. Not the ones that are in the enclosed tents; those are BS. Ones that have good cross circulation. Those are the places you can go if you want to still live life. Everything is a calculated risk. You're going to have to assume, calculate in your mind what that risk is. Just be mindful that we are probably 10 days away from being in a position, unless we do something really aggressive or we get a ton of FEMA support, we're probably about 10 days away from the unthinkable. I wanted to be wrong. I really wanted to be wrong. And the data right now is just supporting not a very good picture. And I'm frustrated and I'm angry. And I'm frustrated and angry because if I could see it coming, that tells me that people in power could see it coming. Because there's people smarter than me that have access to more data than I do and more powerful computers and aren't just doing stuff in Excel or Python to try to figure stuff out. And they could see this coming. And for whatever reason, our strategy now is to let it burn. And there's just part of me that goes, well, then maybe we should have just, if that was the strategy, maybe we should have just let it burn in the first place. We have to do so much better. There's one other thing I want to share on this channel. There's one other idea that I'm going to share that's been rattling in my head. There was all this talk, general strike in September, and then there was some talk about, right, because we've had union efforts that have happened, successful at Starbucks. Amazon gets a revote down in Alabama, New York, right? The efforts is going on in Staten Island, which that passed. People, the Great Resignation, all these people changing jobs. You know, when things get really, truly awful, in maybe about 2 to 3 weeks across most of the United States, it's probably the best opportunity that this country will have for a century, if not more, to have a wildcat general strike. And it's just BS for me to suggest it, because to do a wildcat general strike requires a year of planning and communications and organizers. But I'm going to plant the seed. If 25% of the workforce is out sick, imagine what happens. Imagine Gen X. Hi, Gen X, and Gen Z. Hi, Gen Z. Hi. Imagine if you all, like, when the thing was down 25% and then you all didn't show up to work too. And then you're like, yeah, you know what? We'd really like to go back to work, but there was these promises made about student loan debt. Those promises weren't kept. And you know, if you all kept your promise on that, we might be a little more motivated to go back to work. You're hurting America. 25% of people out, everything's closed anyway. My 25% of us not showing up isn't going to make any friggin' difference at this point, except for really hurting your wallets in the capitalism department, because you are truly shut down, instead of making me do the work of 2 or 3 people to keep making your profits. And you know, there were these promises about, you know, about single payer healthcare, not just from, you know, Trump promised this too. Let's not forget about that, right? Trump promised this, and Biden promised this. We were promised things, and you know, we might be motivated to go back to work if we got these things that were promised. I truly believe that this is not only the best opportunity, but quite frankly, probably the last opportunity that this country has. I'm not the man to organize it. I'm throwing the match. Maybe it'll start a spark. And a spark can turn into a fire. And a fire can turn into student debt relief, the end of the filibuster, expansion of the Supreme Court, and single-payer health care. What's ironic in all of this is that the Trumpers and the anti-vaxxers, which are going to destroy our health care system in the next 2 months, may actually force us into single-payer health care. It's deliciously ironic. Do I really think about? Of course not. That's why I could never be a politician. I don't think politicians' promises are real. I shouldn't say that. There are some honorable, certainly at the local level, there are some honorable politicians. Certainly at local levels. And I think that there are some, but I think, I'm going to sound like an old man, they're not as honorable as when I was a kid. I think the number of honorable politicians is dwindling. All right. So with that said, power to the people, seize the means of production. For the love of God. Mal. Myron, I see you. Not all politicians. There's no good politicians in a corrupt system, correct? Oh no, Kiwi Gal's here just as we're leaving. And with that said, Malcontent out.
Malcontent News is a team of journalists, activists, and researchers with 3 key missions. A commitment to show an unfiltered view of the before, during, and after of key events, live, as it happens. To defend the First Amendment using our rights of a free press. And to amplify the voices of underrepresented individuals, including Black, Indigenous, persons of color, and the LGBTQIA+ community. Our team is committed to seeking equality for all and holding those in power accountable. The easiest way to support Malcontent News is to bookmark our website at malcontentnews.com Like and follow us on Facebook, subscribe to us on YouTube, and follow us on Twitter, TikTok, Twitch, Instagram, and in the Google News app. To provide financial support, you can become a patron, make a one-time donation through Venmo, or link your Twitch account to your Amazon Prime account and use your free subscription to subscribe to Malcontent News. Thank you for supporting independent journalism and for being a malcontent.
You fit the profile. You're the malcontent.
Nobody wants to hear the nonsensical ravings of a loudmouth malcontent.
He said malcontent Antifa, fuck you!
You are the biggest hypocrite on the face of the planet.
I say that you're a terrible reporter. That's what I say.